मानसिक शक्ति के इस कार्यक्रम में आपका स्वागत है। मैं हूं अमरीश श्रीवास्तव, साइकियाट्रिस्ट। हम चर्चा करते हैं इस कार्यक्रम में छात्रों के मानसिक स्वास्थ्य के बारे में, उनकी समस्याओं के बारे में। और इस श्रृंखला में हम हर महीने एक वेबिनार का आयोजन करते हैं, जो या तो किसी यूनिवर्सिटी से या मेडिकल कॉलेज से या ऑनलाइन होता रहता है। कल का वेबिनार बनारस हिंदू यूनिवर्सिटी काशी में संपन्न हुआ, जिसमें देश के 7 विशेषज्ञों ने भाग लिया। और यहाँ पर आज इस कड़ी में मैं प्रस्तुत करूंगा प्रोफेसर पी.के. दलाल, रिटायर्ड हेड ऑफ द डिपार्टमेंट ऑफ साइकियाट्री, किंग जॉर्जेस मेडिकल यूनिवर्सिटी लखनऊ। वो स्वयं तो नहीं आ पाए, लेकिन उनके रेजिडेंट डॉक्टर बबली कुमारी ने उनका ये प्रेजेंटेशन प्रस्तुत किया। हम इसमें देखेंगे कि पॉलिसीज, प्रोग्राम्स कैसी कैसी हमें चाहिए और क्या क्या हमारे देश में है। पिछले 10 वर्षों में मानसिक स्वास्थ्य के बारे में काफी उत्साहवर्धक परिवर्तन हुए। हम ये देखते हैं कि बहुत से कार्यक्रम स्कूलों के लिए, कॉलेजेस के लिए सरकारों द्वारा प्रायोजित किए जा रहे हैं। उसका कितना फायदा लोगों को मिल रहा है, ये एक अलग प्रश्न है, क्योंकि मुझे नहीं लगता कि ये कार्यक्रम लोगों तक पहुंच पाते हैं या लोग उससे जुड़ पाते हैं। हमारा प्रयास है कि अगर हम इन्हीं कार्यक्रमों को भी लोगों से जोड़ सकेंगे तो काफी कुछ फायदा छात्रों का होगा। हम सुनते हैं डॉक्टर बबली कुमारी, जो रेजिडेंट है लखनऊ के किंग जॉर्जेस मेडिकल यूनिवर्सिटी डिपार्टमेंट ऑफ साइकियाट्री में, और हम देखते हैं वे हमसे क्या कहती हैं, तथ्य क्या है, सच्चाइयाँ क्या है, और रिसर्च में, लोगों के अनुभव में कौन कौन सी आवश्यकताएं पाई गई हैं जिनका हमें प्रयोजन करना चाहिए।
Good afternoon, everyone. In this session, I'll be discussing the development of policies and programs for suicide prevention in students. In this session, this is a brief overview. We'll be discussing about the prevalence and risk factors of suicide in brief, the preventive strategies, the need for policy and programs for suicide prevention, the current status of these policies in India, and the future directions, including the key consideration for development of the student-oriented suicide prevention policies. Coming to the introduction, a total of around 164,000 suicides were reported in India during the year 2021, with a national average of 12.0%. This is the data according to the National Crime Research Bureau in 2021. The suicide rates in the age group of 15 to 29 years old in young adult men is estimated to be about twice that of the global average, and it is around 6 times in young Indian women. Suicide is a leading cause of death among youth, making it a critical public health concern. Here are few instances of suicide in students reported in the media. It is important to note that these represent only a fraction of the published cases. These also highlights the diverse reasons behind the students dying of suicide. Students face unique challenges that contribute to an increased risk of suicide. The academic pressures to excel academically, meet expectations, and navigate competitive environment can lead to significant stress and anxiety among students. Social factors such as feeling of social isolation, bullying, or lack of peer support also play a critical role in elevating the risk of suicidal thoughts. The interpersonal conflicts with parents or relationship issues also pose an immediate risk of suicide. High risk taking behaviors and mental health problems like depression, anxiety, or substance use can further intensify the challenges students face, making them more susceptible to suicidal ideations. Recognizing and addressing these factors is essential for students, for schools and communities to implement effective prevention strategies and support systems that prioritize the well-being of student. Now, how to prevent suicide? Preventing suicide is a critical societal responsibility that demands a multifaceted approach. There are brief strategies which can help in preventing suicide. First is promoting mental health awareness, raising awareness about mental health issues, reducing stigma, and encouraging open conversation to create a supportive environment. To screen and identify the risk factors of suicide, to implement regular screening of mental health issues and identifying the individuals at risk, to ensure that they receive appropriate intervention and follow-up care. For this, there should be training programs to recognize the signs of distress and equip individuals with the skills to provide immediate support and connect to people for professional help. Next is implementation of crisis intervention protocols. To establish clear protocols for handling mental health crisis, including helplines, emergency services, and accessible mental health care. To address any stressor or interpersonal conflicts or any adverse life events or any abuse. And also to treat any underlying psychiatric conditions like depression, anxiety, or substance use disorder. The promotion of responsible media reporting is also a helpful tool. It can encourage responsible reporting of suicide cases in media to avoid sensationalizing and contributing to a contagion effect. The implementation of these mental health programs in school and workplaces can also help in supporting and training the students and the staffs. Apart from all these, to effectively address this issue, it is essential to develop comprehensive policies and programs aimed at suicide prevention in students. These interventions should be multifaceted and address various factors that contribute to suicide risk. A one-size-fits-all approach is inadequate. Rather, a nuanced understanding of regional, cultural, and demographic differences is essential in crafting effective suicide prevention strategies. These interventions should be multifaceted and address various factors. Coming to the need of policy. In basic healthcare services, there are various policies like healthcare policy schemes for leprosy, for pulse polio, or national policies by the Ministry of Health and Family Welfare. But as reportedly, there are high rates of suicide, which is suggests the need of national strategies which will raise awareness and help make suicide prevention a national priority. It will provide an opportunity to bring together many sectors of society: government, public health, education, religion, non-governmental organization, users, and advocacy groups. Coming to the current status of suicide prevention strategies. As per the Mental Health Care Act in 2017, there has been decriminalization of suicide. Prior to this law, attempting suicide was considered a criminal offense under Section 309 of the Indian Penal Code. However, the MHCA has brought a significant change in how society and legal system approach an individual who attempts suicide. Decriminalization of suicide decriminalization of suicide attempts and recognizing that individuals who attempt suicide often do so due to mental health issues and they require compassionate and supported care. There are various suicide prevention programs run by the district mental health program. These suicide prevention programs are varied across various districts. In district of Thiruvananthapuram, there is Jeev Raksha initiative is taken by DMHP Thiruvananthapuram for creating awareness to prevent suicide. It aims to achieve this aim through awareness classes and conducting street plays. A helpline number has also been introduced to prevent suicide through crisis intervention. School mental health program by DMHP is there to focus on behavioral and emotional problems of school children, substance use, suicide prevention, stress management, and life skill education. Recently, India has launched its National Suicide Prevention Strategy on November 21st, 2022, which makes it the country's first policy prioritizing suicide prevention. The primary goal is to reduce the suicide mortality by at least 10% in 2030 as compared to 2022. The strategy involves various stakeholders at different levels, including ministerial stakeholders, government stakeholders, mental health institutes, and strategic collaborators. However, there is uneven and fragmented implementation across states and territories, which poses a barrier. But there is lack of dedicated policies and programs of suicide prevention for the students. Hence, there is a requirement for policy development designated primarily for the students. Key consideration for development of policies. First is the universal screening and assessment. And there is the need to identify students at risk, and it has to be done early. There is a need for implementation of universal screening and assessment tool for students at risk of suicide. And this can be done through school mental health screenings, teacher observation, and parent-oriented parent-teacher conferences. School-based mental health screening involves checking in with students at school to see how they feel emotionally. It's like asking them questions to understand if they are going through a tough time. Teacher observations can help, while teacher can pay attention to how students behave in class. Sometimes change in behavior can be a sign that a student is going through a difficult time. Parent-teacher conference. When parents and teachers talk about a student progress, it is a good time to discuss any concern about the student's well-being. Parents and teachers working together can provide a better support. Next is the gatekeeper training. The term gatekeeper is used because these individuals serve as a kind of gate or a point of entry for help and support. These are the first people who are being contacted. They can be teachers, parents, hostel wardens, police, or any lay counselor. For this gatekeeper training to school staff, teachers, and parents will help them to equip them with skills and knowledge, and to recognize the early warning signs of suicide and to manage them appropriately. A gatekeeper training for suicide prevention is also being done by NIMHANS Bangalore, and on their website they have also given the helpline number and the email ID, so that one can any volunteers who wish to be trained for gatekeeper can contact them and be trained. Next is the mental health services. Mental health services are done to ensure that the students have access to comprehensive mental health services, including individual and group therapy, counseling, and medication management. These includes promotive services, preventive services, and curative services. Promotive services focus on promoting mental well-being and preventing mental health issues before they start. These includes stress management, resilience building workshop, yoga, meditation. These services aim to strengthen the mental health in the general population. Preventive services are designated to identify and address mental health concerns at an early age and to prevent them from becoming more severe. These services include school-based health screening, awareness campaigns about common mental issues, and stress reduction programs. These are the examples of preventive services. These services are intended to catch problems early and intervene before they worsen. The curative services are focused on treating and managing existing mental health conditions or disorders. These include psychotherapy, counseling, medical management on both OPD basis or inpatient basis. These services are provided to individuals who are already experiencing mental health challenges to help them recover and manage their conditions. Apart from all this, the national helpline is also available. And the best thing is, even when someone is and even if they are dialing suicide in the Google form, the helpline number is directly available. Apart from that, Telemanas is there for easy accessibility of mental health services. The next is the crisis intervention team. To establish crisis intervention teams within school is there to provide immediate support and assistance to students experiencing suicidal ideations and behavior. These teams will consist of urgent their role is to assess the students' well-being, provide emotional support, and connect them to appropriate mental health resources. Next is the social emotional learning programs. The integrate social emotional learning programs into the curriculum to teach students coping skills, stress management techniques, and emotional resilience. Students can also be taught pro-social behavior like kindness, empathy, sharing, and which can help in building emotional resilience and better coping skills. Adaptive coping skills and problem solving skills, including conflict resolution, general life satisfaction, and it can help in good self-esteem, sense of purpose. Next is the anti-bullying initiative. To implement the anti-bullying initiative is to create a safe and supportive school environment that fosters respect and tolerance. By implementing comprehensive anti-bullying measures in Indian schools, it can help in fostering a secure and nurturing learning environment. These involves awareness campaigns, robust policies, and training programs to address bullying effectively. Regular monitoring, collaboration, and zero tolerance approach collectively can establish a strong foundation for creating safe and inclusive environment in school that also prioritize student well-being. For an effective program implementation, these points are needed to be taken care of. That is, these programs are first is the cultural sensitivity. There is a need to recognize the diversity within the student population and ensure that the policies and programs are culturally sensitive and tailored to the specific needs and demographics of the student population. It should be a data-driven approach. To collect and analyze data on suicide-related incidents within the school community and to inform the policy decision and program effectiveness. This will help in making a guidelines for a strategic organization for helping to prevent suicide. It will also require a continuous evaluation to regularly evaluate the effectiveness of policies and programs and to make adjustments as needed to ensure that they are meeting the needs of students and the school community. And the most important is to keep an open communication and to address the stigma associated with the mental health. And for this implementation, we should foster an open communication culture within the school community, promoting dialogue about suicide prevention to reduce stigma and encourage help-seeking behavior. Parental involvement. We should also acknowledge the vital role of parents and engage parents and guardians in suicide prevention efforts by providing them with information, training, and resources to support their children's mental health. Establishing a suicide prevention policy at school level is crucial in addressing India's high youth suicide rates. Academic stress, social stress, and mental health stigma make school key intervention points. These policy acts proactively enabling early identification and intervention, integrating mental health services, and providing systematic gatekeeper training for staff. It fosters open communication, reduces stigma, and encourages help-seeking behavior. By engaging parents, collaborating with communities, and implementing anti-bullying initiative, the policy creates a holistic approach to ensure a safe and supportive environment for students facing multifaceted challenges. By implementing comprehensive policies and programs that addresses various factors contributing to suicide risk among students, schools can play a critical role in preventing suicide and promoting the well-being of their students. A step forward is the Union Ministry of Education in October 2023 has released a draft with guidelines for schools to prevent suicide among the student, and it has prescribed in its plan of action the setting up of wellness teams, orientation of teachers and family members, and immediate response to student exhibiting the warning signs. Umeed stands for understand, motivate, manage, empathize, empower, and develop. There is a comprehensive school plan for suicide prevention, in which um, it is a multi-stage process which involves setting up of school wellness teams, promoting positive school environment, building capacity for suicide prevention, which helps in immediate response for supporting students at risk. And there is support for students who are displaying warning signs, and immediate responses are taken in cases of self-harm situations. And for all these, there is appraisal for action taken by the school towards prevention of suicide. This is the composition of a school wellness team as per the Umeed guidelines. It consists of a school leader, team leader, who is primarily the school principal, and there is a team of counselor and identified teachers, and teachers who are from foundational, preparatory, or middle or secondary classes. And there is a school management committee, and in which there is a representative from parent side and from the community side. And there is also a provision of peer monitors or leaders for each stages, and there is also a school medical office, a staff nurse, and school support staff. And this is in collaboration with in collaboration with the vice principals, headmaster, teachers, and support staff, wardens, housemasters, and all other stakeholders. The next is to promote a positive school environment by encouraging peer support, by organizing activities on regular basis for relaxing or reducing stress, like yoga, meditation, art, music, gardening, etc., by providing channels for expression, outlets such as access to a trained counselor, help boxes, or suggestion boxes to express concern and seek help, compiling resources to seek support, for like helpline numbers, phone numbers, and email IDs of counselors and student welfare team, or integrating the mental mental well-being in social functioning, which includes aspects of mental well-being in daily interaction, open discussion, assembly time, and different programs. And also creating a safe environment in school and beyond. For example, in school, blocking empty classes, lighting up dark corridors, cleaning gardens, etc. And for places beyond school, there is vigilance at railway tracks, river banks, bridges, cliffs, or medical shops. Positive environment is also promoted by encouraging a school community participation in collaboration with the school administration, teachers, students, medical staff, parents, and community. And also building awareness of mental well-being among stakeholders or through students by role play, storytelling, nukkad nataks, rallies, posters, or exhibitions, or they can be used in annual day themes also. Next is to build capacity for different stakeholders. The stakeholders include all the school counselor, psychologist, social worker, school teachers, teaching, non-teaching. For all these, there are orientation programs to recognize the risk factors, protective factors, to identify the warning signs, and how to immediately respond to students who are at risk, and to provide information to the school's referral and support resources, and to contact details of the local referrals. For next is to respond immediately and support students at risk. immediate response for supporting students at risk. There is a provision for crisis intervention where the students are to be approached and to be provided safe environment. They are to be calmed down and encouraged to open up, and the same is to be informed to the student welfare team, and keeping in mind the confidentiality of the student, and providing immediate care to that student. Along with this, it is also essential to keep the student in follow up, because this is a very important step. It is an essential step required in not only ensuring the safety of the student but also to understand the challenges. The appraisal of actions taken by the school. There should be periodic assessment, comprehensive review of existing practices related to promoting awareness, fostering a positive school environment, staff orientation, sensitization, and recognizing warning signs. And there should be a provision of feedback. Feedback should be actively sought from various stakeholders, including the parents in the wider community, which regarding the school's action for suicide prevention. However, this manual is still in its early phases. We require more guidelines and their effective implementation to sensitize the students, teachers, and parents effectively. These are to be done to ensure that they are more aware and actively engaged in preventing suicide. In conclusion, suicide is preventable. Comprehensive policies and programs can address the various factors contributing to suicide risk among students. Implementing these policies at the grassroots level, particularly within schools, can be instrumental in preventing suicide and enhancing the overall well-being of the students. Thank you.
Yes, it's coming now.
Yes, sir. So my presentation today is on college mental health programs in India, principles, practices, and the future. The topics of my discussion would be the need to address mental health in students, extent of the problem, need for a school mental health program, existing programs in India, issues and possible solutions, and integration of mental health into education. And I'll end with some take-home messages. So need to address the mental health in students. There was a study by Malhotra and Patra in 2014, in which they found that the prevalence of childhood and adolescent psychiatric disorders in the community was 6.46%. That is 1 in every 20 individuals. Whereas when measured in a school setting, it was found to be 23.33%. That is 1 in every 6 individuals. So that is the actual area which needs to be addressed in the student population. Also, the onset of majority of mental health illnesses occur in this age group, that is before the age of 25. Early identification and treatment of the mental illnesses will lead to better prognosis and response. Also, there are important spurts in the brain development at the age of around 6 years and also around 20 years. Also, research shows that an adequate school, social, emotional, mental, and health support will lead to a better academic performance in students. An adequate emotional nurturance in adolescents leads to development of resilience in the individual, which will serve him in adulthood as well. Now, the problem is more attended by social media. There are some excerpts which I would like to display. India Today has asked why should mental health programs be integrated into the school curriculum. The Wire reports that Indian colleges, universities needs to mind students' mental health well-being also. And also there's a question asked that by the Hindu, that why school and colleges in India need more than just guidelines on mental health. Also, some good and bad critical appraisals. this on the extreme right, this report by Times of India about a program started in Bhubaneswar, which focused on students' mental health, which was in view of the rising suicide cases from educational institutions. Also, on the extreme left, mental health platforms are expected to grow big on corporate tie-ups. This addresses the youth and adolescent age groups. And there was another critical appraisal by the Forbes India that announcing a teleprogram is not enough for India, and India must take more holistic view of mental health. Now, coming on to the extent of the problem. 13% is the worldwide estimate of youth under 18 years of age who have significant mental health problems. Also, India has the largest number of children and adolescents in the world, which further explains why the need to address this population in our country. Now, another report about mental health and college students specifically, since we are addressing that college group here, that there are multifactorial reasons for college mental health problems and suicide rates, which are climbing up every year. And the pressure in this age group is not just leaving home for the first time or facing peer pressures, but there are other issues like bullying, exposure to substance use, and experiences which they might not be able to articulate or express. And that is why there is an important need to address their problems. Also, there are other kind of pressure, like pressure from the social media, which is new to this generation, and pop culture influences, which affect the things like body images and self-esteem issues in students. So if we address all these issues, then only we can ensure a positive mental health for the college age group. Now, need for a school or college mental health program. Now we'll discuss some issues. What are the costly negative outcomes of poor mental health in children and adolescents? Poor mental health can lead to academic decline, can lead to drug abuse, can lead to behavioral problems, dropouts from school and colleges, and also delinquency. So we can see how the severity increases with a poor mental health. Benefits of a mental health program in a school and college. Number one, an early identification of emotional or mental health problems. Number two, early intervention in a community setting. Then these the problems which are addressed here, they can be accessible and affordable since they are being developed in the school or college setting. Also, it helps with the easy follow-up and monitoring for a long term. Parents would be receptive. Sorry. Parents would be receptive, and teachers can recognize the emotional problems in the students. Also, for students, such a health program can allow for breaks and opportunities. It can allow for flexible deadlines. It can help them to encourage, seek help, and equip children with tools and strategies that help them manage their emotional problems, and further teach them resilience, which will help them for their future and adult needs, and they will learn to take care of their own mental health. Other benefits of a mental health program in a school or college setting is that it improves the climate of the school or college in general. It improves class behavior or the behavior of students amongst each other. It increases engagement in the learning process as well. And there is a connectedness, a sense of connectedness and well-being in the students. In the long term, like we have discussed, that it helps them to cope their own life challenges and build resilience in the students. Now, what are the properties of a mental health program which could be implemented in the school or college setting? Number one, it should be student-centered. It should address the problems of the students in general, not just people who are diagnosed with mental illnesses. It should be inclusive of parents or at least the peer group in the school or college students. It should be sustainable, and it should be culturally competent. That is, it should address the culture-related needs of that particular school or college as well. And there should be a range of mental health services, which means that there should be different kind of stakeholders which help with different issues in mental health. Like there could be a class teacher or a class peer group which could identify people having some mental health issues, which would then go to a counselor in the school or college setting who can help them with general counseling and coping skills. And third, if required, if they have some serious mental health problems, they could be referred to a mental health professional. Also, the services should be tailored for individual needs as well. So it should not only be deliverable in a whole college or school class as a group program, but also when required, individual needs could be addressed. Now, what are the advantages overall of a school or college mental health program? In short term, it helps with engagement of the students. In a long term, it helps them build positive relationship and also work related skills. Also, in the aftermath of a crisis, they can facilitate a return to normalcy earlier in these students. These health programs are more sustainable because they are closely available to the students and they identify other emotional needs as well. Now, what is a structure of a school or college level mental health program? So this is something which is proposed by the WHO as well. There are 4 levels of interventions, and the first addresses the general mental well-being of the students, where the entire school community is involved. And it is integrated into the school or college curriculum, which would be better for the disposal. Tier 2 addresses the mental health knowledge, attitudes, and behaviors of the students. So this involves all the students and teachers, and again, it is a part of a general health curriculum. Tier 3 addresses the psychosocial problems. So here, counselors, teachers, peer mentors are involved, and the students who have been identified to be needing additional help are addressed by these third tier of stakeholders. Now, tier 4 involves students having severe problems or disorders, and for them, either the counselors or school doctors or other experts are available, or they are referred for professional management. Now, coming on to some existing programs in India. We begin with the Ayushman Bharat scheme, which is although for the school group. Now, the government of India has given emphasis to even developmental delays and developmental disorders as a part of school health program, and they address autism, learning disorders, and attention deficit hyperactivity disorder. In the health promotion section, they also mention about substance use, internet safety and literacy, meditation and yoga, along with the broad category of mental health. Now, coming on to the most important mental health program in India, the National Mental Health Program, which also includes, although it addresses the mental health issues in the general population, it has a separate training manual for psychologists. And in this, there is a general training given to the psychologists who could also be a part of a school or college mental health program. And it helps them identify problems in the student age group. And for example, I have attached a children's mental health screening questionnaire, which can be applied for by these psychologists who can help aid identifying students with mental health problems. Now, coming on to the most important section, the school board recommendations in India. So this is a very important thing, that there is a great both of the self and the environment as a central aspect of the learning process. Now, there are guidelines about all different sections, right from the pre-primary to the secondary school, that how teachers and other paraprofessionals can help in identifying problems, not just mental health, emotional problems, or even stages of change from lower to a higher study or other peer group, and how they can be guided for a better adjustment and a better mental health. They also have a description of how the brain of an adolescent is different, what are the changes faced during adolescence, because this is an important factor which students face apart from their academic pressures. Also, the role of counselors has been defined in the CBSE curriculum along with the role of other stakeholders. So how can parents, teachers, special educators, and administrators in general help with a better mental health program for the school and college students? I would like here to highlight how there are activities mentioned for simple things like controlling anger. There are handouts given for the adolescent age group, that how in a group setting or an individual setting, they can understand handling these emotions and other problems easily. The other program related to education in India is the Sarv Shiksha Abhiyan. In this too, there is a Dropbox facility where children can get support in confidentiality. So they don't have to expose their problems in general, but they can get help. So this can cut down on the stigma associated with emotional problems, and it also trains teachers to identify psychological issues and provide counseling to students. In this regard, the life skills training program was initiated by the National Institute of Mental Health and Neurosciences, and it involved training secondary school teachers for the same. Now, there are many other programs running in India, which although in small sections are doing great work, but there is eventually a lack of overall coordination in the country as a whole. So there was a study which was a literature review about over 15 programs in Kerala, which provided mental health services at various levels. So in this, there were empowerment of parents, teachers, students, leadership training as well, and life skill lessons by teachers given to the students. And overall, they found an improvement in the students' mental health and overall well-being by such programs. Also, the district level adolescent school mental health program, which is with a 3-tier approach, was applied in certain areas. And again, this found that this model was sustainable even in a low resource setting. So everything is available, but the need to apply it to a larger scale is very much felt. Also, there are many programs on universal prevention, about clean campus and reduce access to drugs, which is an important issue, which also aids in the student well-being in general. The IPS Kerala branch also launched a training program, which was called Sneh Kavacham, to address digital addiction and other problems in students, which included teachers and parents as a target population as well. An NGO in Goa called Sangat is working in various areas of mental health in India. And the school health promotion and empowerment program was designed for classes 5 to 12. And the intervention was found to be feasible and acceptable in the school setting with positive outcomes in the health related behaviors. Also, another program which was adapted from the UK was again launched. And here too, it was found to have an improvement in the emotional and language development of preschoolers, and teachers were involved in this program. These are the different areas where the Sangat is working, and there are several programs which they are running for the child and adolescent populations. There are other programs in India, like the Seher program in Bihar, which is strengthening evidence-based school-based interventions for promoting adolescent health. And this also had a low-cost approach in utilizing the service of a trained teacher and a lay counselor. So without expertise training, also they found that they could help a lot of students. And they also found that there was no significant difference between lay counselors and professionals in improving basic social skills among adolescents. There are other projects running in smaller circles in India, and they help in selective prevention. Now, what are the issues and possible solutions about all these programs in India in general? Now, there are certain barriers for implementation. After referral, families face challenges such as language barriers, cost problems, lack of transportation, or lacks of flexibility with their jobs, leaving them unable to make appointments. So even after identification of severe mental health problems, they're not able to reach to the mental health professionals in a streamlined manner. Also, there's an acute shortage of trained mental health professional to deal with even severe mental health illnesses, especially in the rural areas and small cities. In school, lack of personnel for such activities. There is a lot of conflict in schools across different roles, and there is very less motivation to conduct such programs because of an absence of funding. Stigma is a big reason for not seeking mental health treatment, and it is still present in several areas in the country. Further, a lack of dedicated physical space, a non-cooperation of the school management, and the reluctance of teachers to refer the children in need for help. And again, the non-availability of counselors every day, everywhere, or regularly in the campus are other barriers for implementation of such programs. Practical suggestions to overcome these stumbling blocks: involvement of mental health professionals as a proactive approach. So even though we know that there is a lack of mental health professionals, they are not available everywhere, especially in the rural and smaller cities, but with the development of telemedicine and other areas, there could be a more proactive involvement of mental health professionals, and they could also provide training to other paraprofessionals, which could help in the dissemination of mental health services. In schools, screening should be incorporated into the school health program protocol. This is very important in schools and colleges as well. Till that basic step is not taken, it would be difficult to form a mental health program for students in India. Also, there is a need for development of human resources and training lay persons and other paraprofessionals, like it has been identified for emotional problems or minor mental health problems. Even a lay counselor can do a lot of help and identify students needing more help. So if they can be trained and more of such paraprofessionals could be found to incorporate in schools and colleges, it would be of great use. Forming a strong parent-teacher associations is also very important to deliver such a program. Managing stigma, managing financial constraints are other areas which need to be addressed. We could cut down on these by using online resources, by team efforts, and try to, like, there are studies which say that even in low resource settings, things are possible. So it is more about trying to deliver things rather than just complaining about things are not being possible. Now, integration of mental health support into education. This can be a major help for implementation of a mental health program in student population. And the National Council for Educational Research and Training also has taken a lot of steps. They have designed various modules which are available on the website in various languages, even the state languages, and they provide general awareness and general learning about things like gender equality, about general health, about how to make relationships, and how to control on their emotional skills. So if there are efforts being created, there are modules being created, if they could be followed by the student and teacher or college group, it would be helpful. Also, the Government of India Ministry of Education has another module in which there is an early identification and intervention for mental health problems in school going children and adolescents. And this handbook is for teachers and allied stakeholders. So there is a definite approach given in these modules, which if applied could help in a lot of changes in the school and college settings. They also mentioned how the key stakeholders can be involved in a school mental health program, and how these collaborations can help improve students' well-being and learning. So this will involve parents, teachers, counseling, and the student to come in a unified way. It also provides legal awareness for teachers and school administration. So there are many areas like the POCSO Act, the NDPS Act, the Person with Disability Act. So these legal areas there is basic education about these areas as well, so that such students or such people who are needing these acts can also be guided to the appropriate areas. Also, I would like to highlight how simple things like reflecting on adolescence and growing up process. There are modules given in this manual which can help, which have a guideline about how teachers can conduct group activities for students for the benefit of students and help this adolescent age group. There are some individual programs like by some private colleges or other institutions and organizations of which are working towards helping college students. So like the Lady Shri Ram College has a different section for social and mental health initiatives. Also, there are various guidelines of how to cope with mental health being, especially when students go abroad. So they have a different set of problems. So how they can be helped. There are various modules available for such understanding as well. I'd like to end with some take-home messages. The importance of student mental health. Definitely, children and adolescents need nurturing, and their mental health is a shared responsibility of all stakeholders, which includes parents, school authorities, society, governments, and policymakers. For any kind of intervention to be effective, there should be an adequate resource for its implementation, and there should be synergy amongst the efforts made to address the issues. Emphasis needs to shift only not to, there should not be an emphasis only to train teachers, but because they're already overburdened. So we could include other paraprofessionals who with some kind of training, basic training, can be involved in working with the children and identifying their mental health problems. Also, mental health professional must go beyond delivering mental health lectures in schools and colleges to ensure proper initiation, effective execution, and favorable outcomes of the mental health programs. So I know it is too much to ask for, but everyone, if they work in their own circles, they can bring about a lot of change. There is also enough justification for the integration of mental health into education. So if this integration is already based on evidence-based practice, it can promote positive mental health in children and adolescents in India. Also, there are certain college-specific measures which we could apply. There can be youth-driven activities which promotes volunteers and personal mentors who could be trained as frontline support to address issues around mental health within the campus. So as we know, in a college setting, students are away from their parents, and such mentors or friend groups, they can help identify problems earlier rather than any teacher or parents. Also, there should be a tailored curriculum that supports and interests students. So they should find interest in the academic procedure, and also the need to identify problems relating to the self, their emotional problems, and other problems in adjusting to the environment. Developing resilient educators who can handle students with varying needs and also take a keen interest in connecting with their world. This is very much important. So unless and until there are steps taken to understand what is there, instead of being biased or punitive towards students who are going through substance use or other problems, there should be an attempt to make to understand their world and their problems. Also, they can be helped by hosting mental health counseling camps, some wellness week, and also interactive sessions within the campus, which can help them help them with coping strategies, teach them to self-calming measures and other ways to cope up with emotional problems. If a safe and interactive classroom environment is there, and this can help in organizing activities which address other issues as well, like managing stress, managing anger issues, managing the problem of substance use, and coming out for help. So this all can be done only in an interactive environment. Also, there should be an open door policy to help students feel comfortable in sharing their problems and seeking appropriate support. So like I said, if they are scared of being punished or taken to other legal procedures, they'll never come forward. So there should be an open door policy. They should feel comfortable enough to share their problems. Also, trained professionals should be there to provide in-house medical assistance. So although we are talking about paraprofessionals and lay counselors who can help in the process of school and adolescent mental health, but again, sometimes untrained counselors can sometimes do more harm than good. So a basic training, and there should be an overlooking mentor who can see whether such a counseling is going in the right direction. And whenever required, a proper telehealth facility should be provided to the students. Also, encouraging social time by promoting co-curricular activities is itself good enough to build self-esteem and social skills in college-going students. With this, I come to the end of my presentation. These are my references, and thank you, the audience, for patiently listening.
Thank you very much, Dr. Shruti. It is a wonderful review, and we learn a lot what's going on and what needs to be done and what are the gaps. You talked about integration, which is so important, and need for new courses, new professionals, skill building. It's very impressive. The government of India is